Welcome to the Deep Dive, your shortcut to being truly well-informed. Today, we're diving into a topic many are intensely curious about, but might find incredibly difficult to discuss openly. We're going to unpack it, separate fact from fiction, and hopefully bring some real clarity.
That's right. Our deep dive today is into natural penis enlargement. I mean, if you've spent any time online, you've seen it. The internet is just absolutely flooded with claims, products, miracle
Oh,
solutions.
definitely. Everywhere.
But what does the actual medical evidence tell us? We'll be cutting through all that noise and looking at what science, not marketing, actually has to say.
And it's a concern that's far more common than you might think. We found studies suggesting that up to 68% of men are concerned about their penis size.
68%.
Yeah, even when their measurements are completely normal. That statistic alone is kind of mind-blowing, isn't it? It really paints a picture.
It really does. And here's the often overlooked insight. Much of this anxiety isn't really about physical reality, but maybe a distorted perception. We're constantly bombarded with unrealistic ideals, right? Creating this disconnect between what's normal and what people think is enough. It's not just about measurement. It's media literacy, self-acceptance.
That makes sense.
And what's crucial for you, the listener, to understand is that the information out there often comes from incredibly unreliable sources. Treatment for small penises in men with normal measurements. It's supported by, well, scant, low-quality evidence.
Scant evidence.
Exactly. Which is why structured counseling should always be performed before even considering any physical interventions.
That point about counseling really resonates. It sounds like we're not just talking physical facts here, but a huge emotional landscape, too.
Absolutely.
So let's really unpack what's safe, what's genuinely dangerous, and what's simply, nonsense based on the actual medical evidence. Before we get into methods, maybe let's quickly understand the anatomy we're discussing. What exactly is the penis made of, and why is that important here?
Great question. So the penis is primarily made up of 3 cylinders. You've got 2 larger ones, the corpora cavernosa.
Corpora cavernosa.
Right, they fill with blood during an erection. Then there's one smaller one, the corpus spongiosum, which contains the urethra.
Okay.
Understanding this structure is key because, well, unlike a muscle you can build in the gym, the penis is mainly specialized erectile tissue. It's just not designed to grow from, say, external stretching or stress.
Right, not like building biceps. So when people talk about enlargement, are they usually focused on length, girth, or both?
Typically both. Length is how long it is, girth is its circumference, its thickness.
Got it.
And the various methods claiming to increase these work on different principles, though, as we'll discuss. Most don't work at all because they fundamentally misunderstand this underlying anatomy.
I've also heard the terms growers and showers. How does that play into measurements? What should someone really be focusing on?
Ah, yes. That's a really important distinction. Some men are growers, meaning their flaccid size is significantly smaller than their erect size. Showers maintain a more consistent size between states.
Yep.
What's important for you to remember really are the erect measurements. That's the functional size. And, many men seeking enlargement actually have what's known as hidden penis syndrome.
Hidden penis syndrome. What's that?
It's where excess pubic fat, basically, makes the penis appear smaller than it actually is.
Ah, okay. So the solution isn't always about changing the penis itself, but maybe something else.
That's exactly right. Sometimes simpler things like weight loss, better grooming, even just improved posture can make a significant visual difference. No risky procedures needed. It just reveals what was always there.
Okay, so the key takeaway from anatomy. This isn't a muscle you can just work out to grow.
Precisely.
Which brings us perfectly to one of the most widely discussed natural methods, online jelqing. I bet many listeners have heard of it, maybe even tried it. What is it, and does it actually work?
Right, jelqing. It involves aggressively massaging and stretching the penis tissues. The idea, the claim, is to create micro tears that some believe will heal larger.
Micro tears.
That sounds
a bit worrying already.
It should. As for whether it works, doctors and medical organizations definitively do not recommend it. There's just no scientific evidence that it works. And it comes with a whole range of serious side effects.
Okay, hold on. Serious side effects, like...
Well, you can experience pain, irritation, bruises, even curving of the penis, potentially erectile dysfunction.
Erectile dysfunction from trying to make it bigger.
Yes, and here's where it gets really concerning. Jelqing can cause penile scar tissue. This scar tissue can actually reduce penile blood flow,
Oh, no.
causing an inability to get or maintain an erection. And developing this condition, Peyronie's disease basically, can also result in a shortening of the penis.
Wait, shortening, you could end up smaller than when you started.
Exactly. It's not just ineffective, it's potentially harmful and counterproductive. A devastating trap, as you said.
That's a huge risk. So why isn't that more widely known? What about those online studies? Like, I think I saw one called Richard's study claiming it works.
Yes, the Richards study. It reported on 30 men doing Jelqing for 3 months, claiming 87% saw length increases, average of 1 inch. But here's the crucial part. This was not a controlled, peer-reviewed study.
Meaning, for our listeners, what does not controlled, peer-reviewed mean in practice?
It means they couldn't truly confirm if the reported changes were real or just coincidence. The measurement methods were questionable. There was no control group to compare against.
No control group.
Which is absolutely vital for scientific rigor.
Yeah.
Without it, you can't be sure the changes weren't due to chance, wishful thinking, or something else entirely. It separates real data from anecdotes.
So basically, if it sounds too good to be true.
It almost certainly is, especially in this area.
Okay. That brings us to another popular category. Stretching and traction devices. These involve, like, pulling at the glands for extended periods, right? Are those any different?
This is where the evidence gets a little bit mixed, or maybe just misinterpreted. Some scientific evidence supports some elongation from prolonged traction.
Okay, some evidence.
Some. But other medical studies indicate the lengthening effect can be negligible. And here's the really key point. Most of the research on traction devices focuses on treating specific medical conditions.
Like what?
Like Peyronie's disease, that curvature and shrinkage we mentioned, caused by scar tissue.
Right, Peyronie's. So these devices were developed for a medical problem, not for cosmetic enlargement, for guys with normal anatomy.
Exactly. They're therapeutic tools for a specific condition. In fact, a 2019 review did find penile stretching was an effective therapy for Peyronie's disease itself, not for making a normal penis longer.
Okay, that context is critical. What about manual stretching exercises? You know, without a device, pulling upward right, left for 10 seconds, that kind of thing.
Yeah, some men try these, but again, there's very limited evidence they provide any permanent changes. And like any physical manipulation, manual stretching carries an inherent risk of injury. The tissues just aren't designed for that kind of force.
Injury again. Seems like a recurring theme. You mentioned earlier, and it keeps coming up, that this is often more psychological than physical. Can you expand on that? Why is this specific concern so widespread?
This is such a critical point. Look, it's perfectly normal to sometimes feel unhappy with the size of your penis. Many men do.
Yeah.
But a lot of it stems from unrealistic ideals. Many doctors will tell you most men seeking penis enlargement actually have penises that fall well within the typical size range.
What is the typical range?
Generally, the average erect penis is between about 5.1 and 5.5 inches in length and around 4.5 inches in circumference.
Okay. So if most guys seeking health are average, it's less about the actual measurement and more about, like, body dysmorphia.
Yeah.
Or just unrealistic expectations.
Precisely. Body dysmorphia, where someone is overly focused on perceived flaws, can play a role. Many men develop these unrealistic expectations from pornography, maybe comparisons in locker rooms, things that aren't representative of reality. So what they often truly need isn't a physically larger penis, but maybe improved body image, more self-confidence. This is why, again, structured counseling should always be performed first.
Before any physical interventions.
Absolutely. It can help you feel better about your size, understand the context, potentially without needing any physical techniques at all. It addresses the root cause for many.
So understanding perception, managing expectations, that's step one.
Maybe the most crucial step.
I'd argue it often is.
But for those still looking for a tangible difference or maybe just wanting to optimize their overall health in this area, what lifestyle factors genuinely make a positive impact?
Okay, good question. First and foremost, weight management.
Weight. How does that help?
Well, excess abdominal fat, that pad of fat above the pubic bone, can literally hide, sometimes up to an inch or more, of penile length.
Wow, real?
Yeah, so losing weight doesn't enlarge the penis itself, but it effectively reveals what was always there. Makes a visual difference.
Okay, that's practical. What about general exercise? Cardiovascular health. Crucial. Better blood flow means better erections. Simple as that. And better, firmer erections can make you feel more confident about size. Regular exercise, especially cardio, directly benefits sexual performance and overall health.
Are there specific exercises like Kegels that can help?
Yes. Kegel exercises, which strengthen the pelvic floor muscles, can definitely improve erectile strength and also ejaculatory control.
So not size, but quality of erection.
Exactly. They don't increase the actual physical size, but they can certainly improve the quality and firmness of erections, which is often just as important for satisfaction, both yours and your partner's.
Makes sense. And diet or supplements? Is there a magic pill?
Ah, the magic pill question. A heart-healthy diet supports good circulation, which is good for erections. As for supplements specifically for size, there is simply no evidence that any supplement can increase penis size, period.
None, despite all the ads.
None with credible proof. However, addressing actual deficiencies, like low vitamin D or low testosterone, through proper medical diagnosis and treatment, mind you, can positively affect overall sexual function. But that's different from a size increase pill.
Right. And what about habits like smoking and drinking?
Both have a known negative impact on blood flow and erectile function. Smoking constricts blood vessels. Alcohol can interfere with nerve signals and hydration.
So quitting smoking, moderating alcohol.
Can lead to noticeable improvements in erectile quality and overall sexual health. It's significant.
So basically all the things that are just generally good for your health are good for this too.
Pretty much. Your body is an interconnected system. What's good for your heart, what's good for your circulation, is good for your sexual health. No complex secret there.
Okay, now let's talk about the danger zone. What are the biggest red flags listeners should absolutely watch out for when they see these enlargement methods advertised?
The biggest red flag. Any method that promises dramatic size increases, especially quickly. Remember, the penis isn't a muscle. You can't just work it out and make it significantly bigger in weeks. It doesn't work that way.
Okay, fast results, big warning sign. What else?
Be incredibly wary of pills and supplements claiming size increases. They don't work, and some might even contain dangerous unlisted ingredients. Avoid weights or hanging devices. These can cause serious injury.
Like nerve damage or tissue tearing.
Yes, exactly. And pumps, while they can be used therapeutically under guidance, if used incorrectly or excessively for enlargement, can damage blood vessels and actually lead to erectile dysfunction.
The opposite effect again. What about injections or surgery? Those sound extreme.
They are extreme. Injectables and surgery should really remain a last resort, generally considered unethical for purely cosmetic reasons outside of carefully controlled clinical trials.
Why unethical?
Because the risks are significant. Infection, severe scarring, permanent nerve damage, loss of function. The potential downsides often far outweigh any potential cosmetic benefit for someone with a normal penis.
And just to circle back on Jelqing, the dangers there.
Reiterating because it's important. Tissue damage, scarring, which can cause perinees, reduced blood flow, and yes, erectile dysfunction. Some men have actually required surgery to repair the damage caused by Jelqing.
Wow. Okay, so if someone has injured themselves trying one of these methods, what should they do? This sounds like it could be a real emergency.
See a urologist.
Immediate.
Don't wait, don't be embarrassed, don't hope it'll just heal on its own. Early intervention is crucial to prevent potentially permanent damage. Your health is absolutely not worth the risk.
Absolutely. Are there any legitimate medical treatments then for men genuinely concerned about size? Maybe if there's an actual medical condition involved?
Yes, there are surgical options and some devices like extenders, but these are generally reserved for men with diagnosed medical conditions or perhaps severe psychological distress directly related to size.
What conditions would qualify?
Things like congenital micropenis, which is very rare, or significant perineal disease causing substantial shortening or curvature, or maybe severe penile trauma from an accident.
So not just feeling a bit insecure.
Generally, no. For purely cosmetic concerns in men with normal-sized penises, enhancement procedures are highly controversial among ethical practitioners and usually not recommended due to the risk-benefit ratio. Extenders might be recommended in some clinical settings, but only after a thorough evaluation by a doctor.
If someone does consult a urologist about this, what should they expect? It sounds like it's more than just a quick physical check.
Oh, definitely. A thorough evaluation. That includes actual objective measurement of the penis, both flaccid and erect if possible, an assessment of their overall sexual health, medical history,
Okay.
and importantly, screening for things like body dysmorphic disorder or significant anxiety. The psychological assessment is paramount. Often, after proper counseling and understanding the reality versus perception, many patients realize they don't actually need or want any physical intervention.
So the counseling part is key again. Are there support groups or other resources specifically for men dealing with this kind of anxiety? It feels like talking about it would help.
Absolutely, and I highly recommend exploring them if this is a struggle. There's body image therapy, specifically tailored for men, support groups focused on building sexual confidence, even couples counseling if these concerns are impacting a relationship.
That's good to know.
Addressing the emotional and psychological side is just as important, maybe even more important, than fixating on the physical aspect.
Which leads perfectly to the big question looming over all of this. Does size actually matter for sexual satisfaction? What does the science say?
The research consistently shows that penis size is far, far less important to overall sexual satisfaction for both partners than most men believe.
Really, far less important.
Yes, things like partner communication, emotional connection, intimacy, technique, those factors matter much, much more. This is a huge takeaway for you listening. Focusing on these areas will likely yield far greater improvements in your sex life than worrying about physical dimensions.
What does the research say specifically about women's preferences? Because that seems to drive a lot of the anxiety.
Well, studies consistently indicate that the vast majority of women are actually satisfied with their partner's penis size.
The vast majority.
Yes. And when women do express preferences, they often prioritize girth or thickness over length. And even then, the preferences stated are usually much closer to average sizes than many men assume. It really challenges a lot of the common myths.
Okay, that's really important perspective. What about for the men themselves? Does their own confidence play a role in performance or satisfaction?
Oh, it's a massive factor. Huge. Sexual confidence affects performance far more than physical size does.
How so?
Men who are anxious about their size often experience performance issues like erectile dysfunction or premature ejaculation simply because of the anxiety itself. It can create this really frustrating cycle of worry leading to poor performance, which leads to more worry.
Right, a self-fulfilling prophecy.
Exactly. So addressing the psychological aspect, building that confidence, can genuinely improve sexual experiences for both partners, sometimes dramatically.
Okay, so wrapping things up a bit, what's the bottom line here? For our listeners, what actually works if they want to feel better about this aspect of their health and sexuality?
It really comes down to focusing on what you can realistically and healthily control. Your overall health, your cardiovascular fitness, managing your weight, building your sexual confidence through communication, and perhaps technique.
Things that have real benefits anyway.
Exactly. These have immediate, noticeable benefits, both physically in terms of erectile quality and emotionally in terms of how you feel about yourself and your interactions.
Could you maybe give us a practical action plan, like a few clear steps someone could take right now if this is on their mind?
Sure. Okay. Step one, get honest. Is this a real measurable physical issue, or is it more about perception and anxiety? Talk to a healthcare provider or a therapist to get an objective perspective.
Okay, professional input first.
Step two, optimize your overall health. Seriously, exercise regularly, maintain a healthy weight, don't smoke, manage stress. It all helps blood flow and confidence.
The basics, but they matter.
They matter hugely. Step three, learn about sexual techniques that don't solely depend on size. There are countless ways to please a partner. And critically, communicate with your partner about what feels good for both of you. Open that dialogue. Often, what men worry about most matters least to their partners.
Communication is key. And any final thoughts on products or methods to avoid? What's the ultimate red flag?
The ultimate red flag. If it promises quick results, dramatic changes, or it just seems too good to be true, avoid it. Full stop. Always get your facts about male enhancement pills, pumps, exercises, surgeries from reliable medical sources, not slick marketing websites or anonymous forums.
Okay, great advice. How about some rapid-fire myth-busting? I'll throw out a common claim. You give us the quick truth. Ready?
Let's do it. Ready?
Okay. This ancient technique has been used for centuries.
Age doesn't equal effectiveness or safety. Bloodletting is ancient too. We don't recommend that either.
Good point. Next, doctors don't want you to know this secret.
Oh, please. If there was a safe, effective method, doctors would use it or prescribe it. We want patients to be healthy and confident. There's no conspiracy.
Right. How about results guaranteed in 30 days?
Impossible and dangerous. The penis doesn't work like that. Traumatic changes in 30 days aren't happening safely, if at all.
Okay. All natural and completely safe.
Natural doesn't automatically mean safe. We've discussed how Jelqing, often called natural, can actually cause real damage. Arsenic is natural, too. Doesn't mean you should ingest it.
Excellent point. Last one, thousands of satisfied customers. Testimonials online.
Testimonials are not scientific evidence. They can be faked, cherry-picked, or based on placebo. Peer-reviewed studies are what matter for proof.
Perfect. So distilling everything we've talked about, What's the essential core takeaway from this deep dive? The one thing you really want listeners to remember?
Your worth as a man and your quality as a sexual partner is absolutely not determined by the size of your penis. Focus on what you can genuinely improve. Your overall health, your confidence, your communication skills, your emotional connection. Be extremely skeptical, extremely, of any product or method promising enlargement. There's no scientific proof for Jelqing or most natural methods. If you're considering anything, talk to a qualified medical professional first.
That's powerful. And building on that, maybe a final thought for our listeners to consider. What does it truly mean to build authentic sexual confidence, going beyond just physical attributes?
That's a great question to ponder. I think it means focusing on being truly present during intimate moments, instead of being stuck in your head worrying about performance or size. It means learning what actually pleases your partner through open, honest communication, not just guessing or assuming.
Being present, communicating.
And it means prioritizing your overall health and well-being, mental, emotional, physical. That kind of holistic health builds confidence that radiates into every area of life, including intimacy. For single men maybe struggling with this anxiety, remember, meaningful relationships are built on connection, respect, shared values, humor, so much more than just physical attributes. Focus on being the best version of yourself.
And what about partners? If someone's partner is struggling with this?
Patience and support are key. Reassurance can help, but don't just dismiss their concerns entirely because they feel real to them. Maybe gently encourage them to talk to a professional, especially if the anxiety is impacting the relationship or their happiness.
So if you listening right now are struggling with body image or sexual confidence related to this, please know you're not alone, and please don't suffer in silence.
Absolutely. Reach out. Talk to a healthcare provider, find a therapist, look for a counselor. There are professionals trained to help with these exact concerns. You really don't have to navigate it by yourself.
And remember, there's immense courage in seeking help, in prioritizing your mental and emotional health. This deep dive was about getting the facts straight, yes, but even more, it's about fostering your overall well-being.